When private equity firms buy out hospitals, profits can be prioritized over patients. In this week's Bill Break, WENY Pennsylvania Capitol correspondent Kara Jeffers sits down with one lawmaker who wants to provide more transparency and good faith requirements for these healthcare networks.
Hello, I'm Kara Jeffers here with Representative Lisa Borowski, and we're here to take a break and talk about a bill. You have something about hospital closures and how that can have a really big and not great impact on communities in Pennsylvania right now.
Yeah, so we, in Delaware County, where I represent, we had a major health system, Crozier Health System, purchased by a private equity firm, basically dismantled and closed. There were 4 hospitals, 4 acute care hospitals, and they slowly closed each hospital, leaving huge areas of our county without any healthcare services.
So, enter your bill. How's that going to kind of help solve some of the situations going on?
Really, this grew out of what happened in Crozier with the private equity firm coming in, taking over the hospital, selling the real estate that the hospitals existed on, and then making the hospital system pay rent back to the private equity firm. This bill would provide some more guardrails around that, specifically through the Attorney General's office. And the Attorney General would have the opportunity to look at any of these mergers and acquisitions prior to them happening. And it would, first of all, give them notice. So right now, the Attorney General's office finds out when the rest of us do when a press release comes out and there's a newspaper story. It also right now bans the sale-leasebacks, which was so damaging with Crozier.
What's the conflict and pushback you're getting back from some other lawmakers on this?
Right now, there are some stakeholders that would prefer not to be part of the legislation. So we are trying to work with them to see, where can we meet in the middle on some of this.
And lastly, what's going to be taxpayer impact? Any costs from passing this bill? Any savings?
The immediate, cost benefit or benefit to people is, helping to protect our healthcare institutions, making sure that people have a hospital. I mean, we have so many healthcare deserts right now in our state where women are driving an hour or more to see an OBGYN to deliver a baby.
All right, thank you so much for your time. This has been Bill Break, where we take a break, talk about the legislation that doesn't always end up in the limelight.